Welcome. My name is Fabian, and I'm presenting a case study on addiction and family dynamics using the Connor family from Roseanne. We'll explore how addiction manifests in this family system and apply both physiological and behavioral models to understand the impact and potential interventions. Roseanne is a sitcom that ran from 1988 to 1997 and was revived in 2018. It portrays a working family dealing with everyday struggles. Addiction is a recurring theme, particularly through Jackie's alcoholism and Roseanne's misuse of prescription opioids. The family includes Roseanne and Dan, their children, Becky, Darlene, and DJ, and Roseanne's sister, Jackie. The family is emotional close, but often enmeshed, with sarcasm masking deeper emotional issues. These dynamics are important when considering how addiction develops and is sustained. The genogram shows the family structure. Roseanne and Dan are central, with Jackie as Roseanne's sister. Emotional closeness and conflict between the sisters are highlighted, showing how their relationship influenced their substance use. Here we see the roles each family member plays. Roseanne is the matriarch and caregiver, but later becomes a substance user. Jackie is emotional, unstable, and crosses boundaries. Dan is a passive enabler. The children are caught in the triangulation. These roles reinforce addictive behaviors and complicate recovery. From a medical perspective, addiction is a brain disease. Jackie's alcoholism involves neurochemical changes and withdrawal symptoms. Roseanne opioid misuse starts with pain management but leads to dependence. Treatment include detox and medication, assisted therapy such as methadone or naltrexone. Behaviorally, addiction is learned and reinforced. On this slide, you will see Jackie and Roseanne. Jackie drinks to cope with emotional pain. Roseanne uses opioids to escape discomfort. The family enables these behaviors through avoidance and lack of boundaries. CBT and behavior modification are effective treatments under this model. For Jackie, outpatient rehab and CBT and support groups like AA are recommended. Roseanne would have benefited from medical detox and family counseling. Structural family therapy can help the entire family by redefining roles and improving communication. Let's explore potential barriers in counseling when working with the Connor family case study. Denial of addiction. Roseanne's opioid misuse was initially framed as a pain management, making it harder for her or the family to acknowledge the problem. Jackie's alcoholism may be minimized or rationalized as just stress relief. Enmeshment and poor boundaries. The Connors are emotionally close, but often enmeshed, with sarcasm masking deeper issues. Jackie frequently crosses boundaries, which can undermine therapeutic structure. Enabling behaviors. Dan avoids confrontation and passively enables Roseanne's misuse. Family members may resist changing enabling patterns because they fear conflict or destabilization. Triangulation of children. Becky, Darlene, and DJ are often pulled into adult conflicts, creating emotional reactivity. Children may resist therapy or feel burdened by adult responsibilities. Stigma and shame. Addiction carries stigma, especially in working class families portrayed in Roseanne. Shame may prevent open discussion, leading to resistance in counseling sessions. Family members may prefer quick fixes, detox, rehab, rather than addressing deeper relational patterns. Structured family therapy requires redefining roles, which can feel threatening. Jackie's instability and Roseanne's sarcasm can derail sessions. Emotional outbursts may make it difficult to maintain focus on therapeutical. On this slide, we see the Connors agree to go to family therapy for Becky. Becky recovery program commences family therapy. Family discusses the importance of supporting Becky's recovery, and addiction impacts the entire family system. In conclusion, addiction is complex and requires both medical, behavioral approaches. Family dynamics are central to both the development and recovery from addiction. Roseanne provides a realistic portrayal of how addiction affects working class families and highlights the importance of systemic intervention. These references or resources are here to support families like the Connors. I've included local resources in Port St. Lucie, such as the Amethyst Recovery Center, 24/7 addiction treatment, and neuropsychiatric addiction clinic, which detox and also provide rehab services. Behavioral health centers, and they have multiple locations, comprehensive care. Agape Detox Center that deals with alcohol and drugs rehab. Miracle Recovery Center, holistic addiction treatment. Foundation's Wellness Center, personalized recovery programs. Bayshore Club, support group meeting, community-based recovery. Also, the U.S. National Resources, the SAMHSA National Helpline. This can be reached at 1-800-662-HELP, 1-800-662-4357. It's free call, it's confidential, 24/7 help. Findhelp.gov, locator for treatment facilities nationwide. These organizations are essential for connecting families to care. We also have references that includes our course textbook, the DSM-5-TR, and specific episodes from Roseanne and the Connors. They provide the theoretical and cultural context for our analysis. Families are affected when addiction is involved, and it can take a toll on each family members. And these resources are provided so persons can get help. And families can have that assurance knowing that there are facilities, there are people out there that can help them to get through this. It is already a tough time for families to be going through addiction and dealing with family members going through this. So when help and resources are available, it helps to alleviate that worry. Today, I want to thank you so much for allowing me this opportunity to present to you today. And that if there's a family out there today that is dealing with addiction, that they can reach out to one of these resources to get help. It was my absolute pleasure to present on the Connors family, researching the ins and the outs and the tragedy that came along with it. In this presentation, I found out that Roseanne didn't recover, but she lost her life. And this is some of the things that can truly happen when it's gone. too far. So, if there's anyone that needs help, please reach out to one of these resources to get the help and get your family, get your life back together. Because addiction will take that all away from you. Thank you so much for allowing me to present to you today. Have a wonderful and blessed day. Thank you.